Hello and welcome to Connected Conference 2025. My name is Lisa Schaefer and I'm the Executive Director here at Obesity Canada, and we are thrilled that you've been able to make time to join us this week. This year, we're trying something new for our Connected Conference. Our sessions are designed to be on demand and flexible so that you can watch them at your convenience. We want to allow you time so you can absorb new insights and reflect on how they might apply to you and your community. But we're not stopping there. We're also trying something new, and we're hoping that on Friday, March 7th, you will join us for a live roundtable discussion where we're going to bring together experts, advocates, and you, our incredible community, to connect, to collaborate, and inspire some real action on obesity care in Canada. In the spirit of building connections, I also want to encourage you to join OC Connect, our private online peer support community, where you can engage with others who have similar experiences and insights. I also want to make mention that you have the real opportunity to help us shape the future of obesity care in Canada and what Obesity Canada looks like. We are having a stakeholder survey available to the public until March 7th, and your voice is essential in truly implementing meaningful change. And meaningful change is needed because we know that obesity isn't just one person's challenge, it's all of ours. This complex chronic disease that's influenced by biology and environments and the systems that we live in for too long has been misunderstood. It has been simplified and it has been stigmatized. And that's why we're here. And that's what we're trying to do. We want to shift the conversations. We want to take everybody from judgment to understanding, from outdated stereotypes to science-backed solutions, and from isolation to action. We know powerful change comes from making connections. When research meets action, when education inspires change, and when advocacy amplifies voices, we truly transform lives. This isn't a simple journey, but it is one worth taking. Change happens when we come together and use our collective voice. So across 2025 and beyond, you will see Obesity Canada calling on policymakers, healthcare providers, and everyday Canadians to join us, to challenge the bias, to break down barriers, and to rewrite the narrative of obesity in Canada. With our collective courage, I truly believe that we can build a Canada where health is not defined by size, but rather the freedom to thrive. These are important conversations, and again, we are thrilled that you are here to join us. I also want to thank our generous sponsors who have made the event possible this year, but really, thank you for being part of Connected 2025, and thank you for believing that better is possible. Let's go make this amazing.
Hello, and welcome to Obesity Canada's annual public virtual conference, Connected 2025. This year, the theme is It's Bigger Than Obesity, Connecting the Dots in Obesity Management. We know that obesity is a complex chronic disease, but we also know that it's one that doesn't often happen in a silo. It's generally connected to a number of other health conditions. So with that in mind, we wanted Connected 2025 to focus on some of the more important intersections that happen with obesity management. Today, we are talking about obesity and liver disease. This session of Connected 2025 is brought to you in partnership with the Fatty Liver Alliance. With us for this discussion, we will have Dr. Supriya, Joshi, and Michael Betel from the Fatty Liver Alliance. We'd like to take a moment to thank our sponsors for this conference who have made this possible. Thank you to Shoppers Drug Mart, Pfizer, Novo Nordisk, Boehringer Ingelheim, and Johnson & Johnson. Connected is our annual public conference for World Obesity Day. You can find the archives of previous conference recordings on Obesity Canada's YouTube page. This year, we're spreading the virtual conference out over the course of a full week. Each day, we have a new keynote session released here in the virtual venue that you can watch on demand. So make sure that you're coming back every day to check out what's new by clicking on the on-demand video section. In the lobby, you'll find valuable information about our sponsors and speakers. Discover the sponsors who make this week's conference possible and explore details about our speakers, including their bios. On Friday, March 7th, we'll wrap up the week with a live roundtable discussion featuring Dr. Sokolingam, Dr. Proder, Lisa Schaefer, and Ian Patton. This dynamic conversation will take place at noon Eastern Time and will provide insights on how we can all take action and be part of the shifting tides in obesity management. Throughout the week, if you have any questions that come up, please either make note of them and bring them to Friday's roundtable discussion, or you can send your questions to Ian at obesitycanada.ca. We will do our very best to answer as many questions as we can throughout the week and on Friday. My name is Lauren Gates, and I'm a non-healthcare professional living in Calgary, Alberta. and I'm a member of the OC Connect community. It's both an honor and a pleasure to be your host for this week's conference. With a personal connection to obesity, my goal is to bridge the gap between patient lived experience and professional practice, fostering a more compassionate healthcare environment. I hope that the conversations that we have this week will inspire greater empathy, deeper understanding, and more effective patient care, while providing education and support for those who are impacted by the complex chronic disease of obesity and its related conditions. Now on to today's topic, obesity and liver disease. Let's start by introducing today's experts. Dr. Supriya Joshi is a gastroenterologist and hepatologist at Trillium Health Partners in Mississauga, Ontario, and a lecturer at the University of Toronto's Temerty Faculty of Medicine. She specializes in metabolic dysfunction-associated liver disease, MASLD, and is passionate about educating both the public and healthcare professionals on liver health. A frequent speaker and media expert, Dr. Joshi has appeared on CBC Marketplace podcasts and virtual platforms to discuss the impact of sugar, diet, and lifestyle on metabolic health. She shares evidence-based liver health education through her social media platforms at Liver Health MD, which has grown over 100,000 followers in just 1 year. She serves as a medical advisor for the Fatty Liver Alliance and continues to expand her expertise, recently completing training in sustainable nutrition in lifestyle medicine at Harvard University and coaching for healthcare professionals at the University of Toronto. Outside of medicine, Dr. Joshi loves travel, fitness, cooking, and spending time with her family as a wife and mom of 3 kids. Michael Betel is the president and founder of the Fatty Liver Alliance, dedicated to raising awareness and advocating for better research and resources for those living with MASLD and MASH. Based in Toronto, he has 30 years of experience in liver disease across both commercial and nonprofit sectors. A passionate advocate, Michael has played a key role in educating the public, organizing initiatives, and shaping policy around fatty liver disease. He is a respected speaker and media commentator, frequently featured in news outlets and at conferences. His leadership experience includes senior roles at Hoffmann La Roche, Canadian Blood Services, and Schering Plough, and he is currently serving as the chair of the Global Liver Institute's Liver Action Network. In 2024, he received the Global Excellence in Advocacy Award from GLI. Michael actively contributes to advisory and global initiatives focused on liver health, including the Canadian Association for the Study of Liver, CASL, Regeneron's NASH Power Council, and the Global NASH Council. He has collaborated with AASLD, EASL, and Mosaic on key consensus statements and research priorities in fatty liver disease. In addition to his work at the Fatty Liver Alliance, Michael is also a respected speaker and commentator on fatty liver disease-related topics. He's been featured in various media outlets, including newspaper, radio, and television, and has spoken at conferences and other events to raise awareness about the disease. Welcome, Dr. Joshi and Michael, and thank you so much for joining us today. So if we could start, Dr. Joshi and Michael, with you just telling us a little bit about the work you do and what got you interested in this space in the first place. Dr. Joshi, let's start with you.
Thank you so much for the introduction and including us to be here today to discuss this great topic with you guys. So as a gastroenterologist and liver specialist, I see a lot of people complaining about digestive health issues. And what I was seeing and what I still see very commonly is people suffering and being diagnosed with end-stage liver disease. Ultimately, this is called liver cirrhosis. And when this happens, people are at risk of liver failure, liver cancer, and many people say, I wish I knew earlier what interventions I could have made to prevent this outcome. So because of that, I have been very involved with educating people on steps they can pay attention to in their life, whether it's in their 30s, 40s, 50s, and 60s. It's actually never too late to implement changes that can not only improve their metabolic liver disease, but can improve many aspects of overall metabolic health, which are closely entwined with obesity-related complications. And that's how I see the connection and potential impact to improve people's overall health and chronic disease.
That's awesome. That's really interesting. Michael, how did you get involved in this space? What really drew you to it?
It feels like it's been forever, and I've known Supriya probably for almost 30 years, I think. I started in the hepatitis area, hepatitis B, then they had non-A, non-B hepatitis C, and I have always been involved in the liver space. And so when I started to learn that this spectrum of disease. Fatty liver is what the general public calls it, but MASLD and MASH, as you referred to it before, is becoming more and more prevalent. I decided that I wanted to focus on this area, and as it turns out, I have a lot of these metabolic comorbidities that we'll talk about today in my family, and so it's really important to be able to share information and see what we can do to help people avoid this disease from the beginning. And, it's hard enough once you know you have something, but if we can avoid it, that's always going to be the better route for us. I know Supriya spends a lot of time trying to teach people the right things to do every day, and I appreciate what she does as well. So,
fighting the good fight, as we say it. That's fantastic. So before we get too far along the science, can you please help our audience understand the various acronyms that we hear related to liver disease? So what those acronyms mean, there's the MASH, MASLD, NAFLD. For those who aren't familiar, what do those stand for?
Should I take this one, Mike?
yeah, sure.
Sure. So the old name is called fatty liver disease. However, what you're referring to is NAFLD, we call it non-alcoholic fatty liver disease. And if people were found to be regular consumers of alcohol, it was alcohol-induced fatty liver disease. So those names have now been dismissed, mostly because of the connotation to the word fat, which can be stigmatizing, but also because it assumed people drank alcohol or didn't drink alcohol. And so there's a lot of just a bad vibe around that diagnosis. So last year, a group of liver specialists made this name change from NAFLD to MASLD. MASLD refers to metabolic dysfunction-associated steatotic liver disease. So it's a mouthful, but that name more correctly connects the cause of the condition with what's happening, meaning it is metabolic dysfunction. And so MASLD just means there is the presence of fat in the liver, in addition to a cardiometabolic risk factor, which could be high blood pressure, high cholesterol, elevated weight or obesity, and elevated blood sugar or prediabetes. So those are the metabolic conditions related to presence of fat in the liver. The other name you refer to as MASH, M-A-S-H, which is metabolic dysfunction-associated steatohepatitis. The SH part, or the steatohepatitis, refers to the liver fat causing an immune response or liver inflammation with resultant liver fibrosis developing. So people who can have presence of fat in their liver, but not actually end up with progressive liver inflammation or cirrhosis. But people who have the inflammatory response are the ones who are at risk of developing cirrhosis of the liver and the other complications, which could include liver failure and even liver cancer. But we're also learning, even without the liver inflammation, people just with liver fat, they're actually also at risk of getting liver cancer as well. So the hope is that these new names in terms of terminology give better understanding to the root cause. And by identifying that, we can be less stigmatizing, but also allow people to correctly know and learn how to make changes to improve their metabolic dysfunction. And by doing that, the liver fat can actually improve and reversed, which is an amazing thing to know about.
I would just add, Supriya, too, that ironically, it's the liver trying to heal itself that's causing the scar tissue, which is called fibrosis. So people know what that is, that it's actually trying to heal. But because the liver becomes damaged with this repetitive scar tissue, which everybody knows what that is, right? That it doesn't work as well to do what it's supposed to do. I don't know if
Correct.
you want to add to that, but yeah.
Yep, you're absolutely right.
Interesting. So that's really interesting. I'm sure we'll get a little bit more into, I didn't realize that the liver can heal itself. So that's really interesting. Can we talk a little bit about what is fatty liver disease? What are the signs and symptoms? How could someone, know if maybe they have this or they're at risk for this? How prevalent is it? Can we get into a little bit of the basics here for those who aren't aware?
Yeah, so as I mentioned earlier, the diagnosis comes from the presence of liver fat, which I'll explain how that gets there in a moment, in conjunction with one of the cardiometabolic risk factors. So type 2 diabetes, high blood pressure, high cholesterol, elevated weight. So the presence of liver fat may even be driving these processes in addition, because liver fat does not typically come from someone swallowing something that is fat. And that was one of the misconceptions about this condition. So liver fat is a process that develops from something called de novo lipogenesis. That means your own body hormones and mechanisms of metabolism will convert excessive sugar or fructose into liver fat for energy storage. So liver fat is actually just stored energy. And when your body needs that energy, it will convert that liver fat back to a usable source to power your cells. So liver fat is a bank of energy, usually resulting from overconsumption of certain types of foods or macronutrients. And typically, that is excessive intake of glucose or sugar and refined carbohydrates, because that type of food ends up becoming sugar. And when your cells have too much of it in the blood, again, this is a very simplified explanation, that excessive sugar or glucose is converted to fat and stored in your liver, waiting for your body to use it.
Interesting. Is there anything that you would add, Michael?
Well, that was very well said. But when Supriya's talking, I'm thinking, and she's 100% right about that high glucose, the risks that we all take when we have high sugar, and how we were all brought up thinking that fresh squeezed orange juice, as an example, was healthy, when in reality, it's definitely nowhere near as good as having a fresh fruit by itself, because it's missing a lot of the fiber, and it's important really to try to avoid that high sugar content. I know Supriya's talked a lot about Coke, in particular. All the sugar drinks, like the soft drinks, are horrible, and I think that is probably one of the worst culprits. I know you said, Supriya, recently we had a community function that she has patients that are drinking like 10 of these a day, and that's incredibly damaging.
It can even just be the Canadian Tim Horton double-double.
Yeah.
Has far more sugar.
How many spoons of sugar in that? Not two. Tell them.
No, not depending on the size somebody orders. Like a medium or large double-double can have, 8 to 10 teaspoons of sugar. So it's nowhere near what people think that they're consuming.
So interesting. So sugar, sugar, that's a topic when we talk about obesity. We talk about that when we talk about insulin resistance, when we talk about diabetes. So this is really interesting. Can you talk a little bit about the intersection between obesity and liver disease? How are these two conditions related? How common is that intersection, and how often is that appearing in your practice? Maybe Dr. Joshi, if you can start us off.
Great question. So approximately more than 90% of people undergoing bariatric surgery who are there for obesity management will have presence of liver fat. So it's very tightly correlated. And you're absolutely right. The word insulin resistance is this underlying theme. And once there is liver fat, what then further happens is called hepatic insulin resistance. So that will further perpetuate weight gain. And when people have the lifestyle of overconsumption of certain macronutrients we talked about, like the refined carbohydrates, but also having an inadequate intake of protein and fiber, and they're also not exercising or purposely building their muscle strength, then that's all insulin resistance. And the less muscle we have, the more prone to insulin resistance people will be. And this is the balance of good nutrition and regular maintaining good body movement and muscle strengthening is very important, because over the age of 35, we all as humans are going to lose a percent of muscle mass per year. So tied with that, if nutrition is not optimized, further insulin resistance can be worsened, and that will perpetuate weight gain. And with more weight gain, people can get, osteoarthritis, aches in their hips, aches in their joints, and may not feel as inclined or be as comfortable to move their bodies. But in actuality, exercise is what they need to maintain strength and functionality and to improve insulin resistance.
I'm curious about the orange juice. So what is the difference exactly? The fact that the orange has the fiber and the juice doesn't have the fiber. Okay, so Dr. Joshi, I'll let you go first to answer this question.
Let's talk about orange juice. So when it comes to drinking orange juice, the issue with it is that when you're drinking something, we can't ignore gut physiology. And that when you drink something, obviously it's liquid, so it goes down the GI tract much faster than if you were to chew something. And when you drink juice, you're not really chewing. So it goes down and you're not going through mastication, which improves, the digestive enzymes ready. And then when it's in liquid form, it's more rapidly absorbed across the small intestine. And there's not as much gated absorption, and that can lead to a post-ingestion spike in the blood sugar and even insulin. And that's the kind of process that leads to insulin resistance when there's too much of this going on in their lifestyle. Versus if you just eat the fruit, you get mastication, with digestion starts in the mouth, and you get the appropriate rise in digestive enzymes and a slower absorption by the fiber that's in the orange itself. So in the end, it's better to eat the fruit than to drink it.
Absolutely. You think about a bottle of juice and how many oranges are in that juice. Could you eat that many oranges? If not, maybe that's too much juice.
Lauren, I'm thinking an even bigger problem is the children for decades that have been given apple juice to go with their lunch for school, in which case there's like no fiber in it at all, really, compared, we talked about orange juice. But on top of that, there's a very, very big problem right now with children, adolescents with MASLD. And it's like mid 30%, 35% now of kids have fatty liver disease or MASLD. And it's caused a lot by lifestyle decisions and choices and sedentary lifestyle in part as well.
Goodness, is that a lot younger in recent years? Have we seen a change recently?
Yeah, I'll let Supriya speak, but I think it's getting way more common now in kids.
Oh yeah, it's tripled compared to 1980, which is following the obesity statistics for children, right? Tripled since 1980. So definitely it's lifestyle, what kids are getting fed, what they're drinking, and sedentary lifestyle as the main parts of it.
Wow. Goodness. So if someone is experiencing this disease, the liver disease, how does obesity management fit into that equation? What does treatment look like? Or is the treatment similar for someone who is living with overweight or obesity versus someone who is not? Can you explain a little bit about the treatment for this disease?
I think you're asking me, because maybe just say the name of who you want to answer. Pause, because I'm just
okay.
Why don't we redo that and just say the name of who you want to answer? Is that okay? Because you're looking, I'm looking at it, I can't tell where you're looking.
Oh, sure. Yeah. Here it just says like whoever, but yeah, absolutely. I think that makes sense for you to answer that one. So, so for someone who's living with the disease, the liver disease, how does obesity management fit into that equation? And is there a treatment for someone living with the disease that's different if they have obesity or overweight, or if they don't have obesity or overweight? Is there a different treatment protocol?
Personally, I don't look at body weight. I look at the person's lifestyle, and I look at metabolic dysfunction. Those are my goals for improving someone's overall health. And then weight loss is often a side effect of making those lifestyle changes. At the same time, I completely, respect if someone has been struggling with their weight and they've gone through yo-yo dieting, and that can certainly put somebody at a more challenging position for trying to achieve weight loss when that's their goal. So while lifestyle, I think, is a foundation of improving metabolic health, we certainly cannot ignore the huge benefits what we have available today of pharmacotherapy and obesity management. So I think in conjunction with lifestyle, we should not ignore the agents that we have available, which are the GLP-1 agonists, and even the dual medications that are available, and even including bariatric surgery. So those are all options on the table to help somebody who's suffering from obesity and metabolic dysfunction.
Perfect. So Michael, I have a question for you. You do a lot of advocacy in the liver disease space. What are some of the challenges and barriers that people living with the disease face that you're seeing? And have you seen a shift in how the community is thinking about obesity in the context of liver disease?
Well, I think first of all, the biggest challenge is the lack of awareness and the lack of knowledge. And most people who have liver disease have no symptoms, so they're completely unaware very often until it's too late. So because we now know that obesity and the challenges that are involved with that are all part of this metabolic syndrome, a lot of patients who struggle with obesity also have type 2 diabetes. They very likely are going to have the need for using CPAP for sleep apnea. That could be a problem. It's very possible they also might have high cholesterol and all of those other related, and they just so often go together. And as it turns out, we have learned that we need to take care of each one of these comorbidities as we become aware of them. So very often, patients will become aware of one of these disorders. It doesn't have to be the liver. It could be that they've been struggling with weight, and because of that, they develop type 2 diabetes. And so they can start to get treated for type 2 diabetes, or if they're pre-diabetic, they can it could be through GLP-1s that are available and being used very widely now. They could go to gastric bypass if that's an option for them. There are other ways, just day-to-day life, that people can increase their activity and decrease what they're eating and making other choices. All of these things will lead to weight loss, and if we can get the weight down, we can very likely also deal with some of these other comorbidities that just go hand in hand. Did I miss something, Supriya? So
no, I thought that was excellent.
It's like I use the tapestry thing, and it's like they're all interwoven, and we don't have that luxury anymore of saying, oh, somebody just has this, because almost always they have 2 or 3 or 4 or 5 of these things. I have a few, and probably most people have a few, and some we're not even aware of. I think, though, I want to add that we also seem to become aware of the first comorbidity that we have just by going to the physician, and it very often could be a blood test that comes back abnormal, or it could be an ultrasound for something else, and they go, hey, and then you find out you have that, and then you either go to an endocrinologist, or you go to a hepatologist, or you go to a gastrologist, or the primary care physician, or whatever the specialist that happened to have that they diagnosed you with. That's your first specialist. And what we're trying to do is to get people to know that this is a multidisciplinary issue and challenge, and physicians need to really work together with the patient so that we have a holistic approach to care for patients.
Very well said.
Thank you.
Similar, that's something that we talk about a lot at Obesity Canada, is how obesity is a complex and chronic disease, and it's multifactorial. So this is really interesting. I'm curious about that coordination between specialists and physicians. Oftentimes, their GP, their family doctor, is their first point of contact to kind of open the door to discovering that they may have the fatty liver disease, and then they may have some other issues to explore that are comorbidities or interconnected ailments, if you will. What are some of the challenges and opportunities that you see with coordination of care, Dr. Joshi? And is there anything that we can be doing better? Are there some positives that you're seeing, some challenges? I'd love to hear more about that.
I think the biggest challenge is that we don't have good funding for dietitians, nutritionists, and even giving people recommendations on exercise. All of those things are private pay, and I find a lot of my patients just don't have that ability. So sometimes it can be just lack of education about what is the optimal way to improve all these pillars of lifestyle. But then many people need assistance. They need help to guide them through it and get them through their journey. And so that's where I think, not having ready access to someone to help them with nutrition and physical activity is a big barrier. And then when it comes to, referral to colleagues that will be managing the comorbidities that can affect patients with obesity and metabolic dysfunction, I think once you have your own system in place, it's good to know who you can refer to on a regular basis, but there's still wait times. We know that in the Canadian system, because there's urgent referrals, then there's routine referrals. And these ones would not often be considered in the urgent category, So I think those would be the drawbacks that I see and I experience.
And as a specialist, is there anything that would make your life easier if GPs knew to do a couple things to support the referral or the coordination of care with someone like yourself?
Well, I always love a complete referral. So I don't like when someone just says, oh, fatty liver and ultrasound, but not attach it. So in terms of a full referral, I want the imaging. I want the liver enzymes. And as a liver specialist, I want to rule out other liver diseases that could also be at play. I have many patients who I've diagnosed with autoimmune liver disease and fatty liver. They have hepatitis B and fatty liver. So I'm treating 2 liver conditions. So I still have to rule out the other one. So it'd be great if there was, initial screening of other treatable conditions that could be done by primary care. But certainly at least liver enzymes and imaging. And in Ontario, we'll be having the FIB4 now available as a test to order on our lab requisitions. And the FIB4 is a test that primary care physicians can now order to be predictive of who is at risk of advanced liver fibrosis or cirrhosis. And that is a test that can help us triage what is considered more urgent and who needs to be seen by a liver specialist.
Interesting. Those are great tips. I think the more we can all coordinate with each other and work together, the better everything will be for patient care and for sanity at work, I'm sure. And so just to shift gears a little bit here, Michael, you've been very active as an advocate in the liver disease space. What can patients in the obesity space learn from you and from your experience as an advocate? And what are some of the biggest opportunities to improve access and quality of care that you've seen in your area, like that you've been able to help facilitate?
Well, okay, the first thing I'm going to quote Dr. Naeem Al-Khoury, a hepatologist in the States, who said, just do something. So, we often hear about it's really important to do 10,000 steps a day, but guess what? And Supriya talked about it before. For some people, 5,000 steps is a struggle, especially when they're having challenges with excess weight and maybe that they have had some muscle loss. And so anything that they do is better every day. And I tell patients and other people in the community this as well. Like when I park, including this morning when I went shopping, I always park further away from the door because I want to take those extra steps. And I take the stairs instead of the elevator. All those things add up in a day. If you do just a little bit through the whole day, you've probably got 10,000 steps just doing those little bit of extra things. I try to, when the weather's good, go for an hour walk in the morning, and that kind of starts me off the right way. And I don't try to run. I don't want to damage my knees. I just walk, and I enjoy the walk, and that gets things started for me too. So, but I try to share from conferences. You asked me what I do. One of the things I do is I travel to many conferences around the world, and I go to the talks, and I try to translate the science to usable knowledge for patients and other allied health, so that we are all on the same page with regard to how quickly things are changing and what can be done today to help. And so we can all, we learn at all these conferences, there's new information. Supriya talked about the gut health. That in itself is a whole topic. One of the things that I really try to focus on, it's the wearables, the new tools that are available. I have I have an Oura ring that I wear. I have an Apple Watch that I wear. And these are just little things that give me information all day long about, I have to walk a little more, I've been sitting too long, it's time to stand up. It gives you all these reminders of what you need to do. And sleep too. Sleep is very, very important to have quality sleep. It's an indicator of unhealthy behavior that leads to liver health issues and obesity issues, I think, for patients as well. So I don't know, we're just learning.
Yeah. It's really interesting. I'd love to go back a little bit more into what is the latest and greatest that you're hearing about, Dr. Joshi, about the gut microbiome and how that affects liver health. Like what, not as a non-medical professional myself, if you can explain it to me as if, we're at a dinner party and I've just asked you this question and I have no medical background.
Well, I would say that you're absolutely right to think about it, because there's more bacteria and microbes living in our gut than there are cells in the human body. So they need to be respected and they need to be fed well. So we know from data that our microbiome is very much, involved with our insulin sensitivity, our metabolism of micronutrients, and what goes through those gut barriers into our portal circulation and what's fed to the liver. So our gut microbiomes don't like junk food. They don't like processed food. They don't like a lot of sugar and high fructose corn syrup. So those are certainly things that can disrupt the microbiome and the gut membranes. And I'm sure you may have heard of something called a leaky gut. And the theory is that that leaky gut can further cause, issues in our immunity and insulin resistance. So being good to your gut is essential.
I definitely heard about leaky gut, that there's a barrier there, and there's things that are supposed to stay in the intestines and things that are supposed to be outside. And when that barrier, when that boundary is crossed, some interesting things can happen, is how I sort of understand it.
Yeah, you're right. And I think when it comes to suboptimal lifestyle, it can cause people to have bloating, indigestion, heartburn, irregular bowel habits. And as a gastroenterologist, I quickly learned that the optimal diet that will improve metabolic or fatty liver disease also improves the gut health, and symptoms can improve. So it really, there's a lot of, interconnectivity about all of these conditions.
Absolutely.
Supriya, with everybody there's so many illnesses going around right now, right? There's a lot of flu and people are going on antibiotics. So or taking the antibiotics, also take probiotics to help with their microbiome?
Yeah, I think that's a great suggestion.
I don't know if people know that or not. So,
well, there's no strong evidence that people must do that. But I think, maintaining optimal nutrition, activity if they can, and a probiotic can always be helpful, but it's not something that's a must for people.
The way that I like to think about feeding my microbiome is lots of color, lots of different plants, and lots of variety. And I'm doing it for the biome.
That's exactly it. That's real food. That's really all the messaging is. It doesn't need to be complicated. Just eat stuff that's real.
Exactly. And it's delicious too. So, Michael, you mentioned sleep. So I'd be curious about both of Dr. Joshi and Michael. I'd be curious about both of your thoughts on this, but the connection, we're going to have a session as well with talking about sleep apnea and health and the intersection between sleep and obesity and elevated weight. I'd be curious to hear how you think that connects, or how that connects with liver disease. Either one of you can start.
Sure. Okay, I'll have to go. So we know that poor sleep can actually make people hungrier the next day, have a lower resting temperature, higher cortisol, and all of that can affect someone's physical activity that next day, and even food choices. So we know that poor sleep is very important, and if someone has sleep apnea, as mentioned earlier, that also increases risk of cardiovascular disease and other poor endpoints in cardiovascular and cardiometabolic health. So being screened for sleep apnea is very important, because treatment of that can actually improve many of the cardiometabolic risk factors we've talked about, and can even improve weight.
Absolutely. Michael, what are some of your thoughts on the topic of sleep or weight and the intersection of it all?
Well, what I've learned is the regularity of sleep is important too. So if you can go to bed, I go to bed at 10 o'clock, which is probably too early, but I wake up at 5. So, but whatever it is that people do, they should, if they wake up and go to sleep at the same times every day, I think that regularity is really important for the body to do what it does. It gives more time for healing and for repair of damage in the body as well. So I think those are things that I try to focus on as well. But like I said, I have a CPAP that I have to use, and I actually find that it helps me sleep better. But I know that if you can avoid some of the damage that's done by not wearing a CPAP, it makes a big difference as well.
Yeah, I can imagine it stresses the body out not to get enough oxygen, right? So
not breathing like 18, 20 times an hour, it could cause problems.
Yeah, that's generally probably not a good thing for our bodies in general and our metabolic health, I would imagine. So are there any resources that you think you'd like to call out or mention to make liver disease management easier for those who are living with liver disease and obesity? Dr. Joshi, I'll start with you.
Well, I can't give enough kudos to Mike and what he started with Fatty Liver Alliance. Like, it's outstanding. I refer all my patients to it. I think it's a great resource for people to learn about and to hear information from someone who's not a physician, to hear information about, what's going on in the studies and bringing it to relatable terms for people to understand and hear. I think his resource is phenomenal.
when I speak about our own website, thank you very much, Dr. Joshi. We have actually it's fattyliver.ca / patient dash portal. So it's up. There's a patient portal. We just added 6 segments right now for patients who already know that they have MASLD and MASH, and trying to have conversations with key opinion leader physicians from around the world, so that people can understand in really easy terms what it is that they're dealing with. What is MASLD? What is MASH? How does it progress? What can I do to help it? What about my physicians? Who do I go to? What do I say? What do I tell my family? All of those things are covered, and there is more than enough videos and blogs out there for people if they want to just jump in and pick the area that they're interested in as well. So I work really hard to try to put together a site that's easy to use and has a lot of information. So thank you for giving us that opportunity to highlight.
That's fantastic. I'm curious about the parents who were listening earlier today, thinking about their kids drinking the apple juice and the orange juice. Are there resources there as well that they can learn how to maybe prevent or do the right things for their kids before this even becomes an issue, or they start seeing signs in their children, and to understand, the impacts of including that fiber, including that protein, doing the right lifestyle factors to take care of the metabolic health, and maybe ingraining that in their parenting? Are there resources on your site as well for that? And is there anything else you would suggest?
Well, there is one video session coming up on food in particular, but LinkedIn and X are 2 of the channels that we use, Facebook as well. And Dr. Joshi and I actually had some fun doing this recently too, going into a grocery store and looking at the ingredients that are on products like cereals as an example. And just this morning, I did post something. It was like looking at Raisin Bran, which everybody thinks is healthy. That's not even the cereal of choice probably with kids, because they're having Fruit Loops and Frosted Flakes and Corn Pops. But I'm talking about the parents that are trying to do the right thing, and then they do like Raisin Bran or something, and it had 70 grams of carbs in like a small bowl. Like nobody has a serving size in a cereal. It's like at least twice that in a real bowl. So it was like 70 grams of sugar or something like that. And so you can be fooled really easily. I'm going to reiterate Dr. Joshi's key message all the time, and that's about read the labels. You need to see what's on the labels and what you're giving to your children, even though it says that it's healthy, even though it implies in the name that it's good. It doesn't mean that it's really good. And you can judge for yourself just by looking at the labels. And, Dr. Joshi, you could talk about what is a target number of grams of sugar a day. I know you've shared that before, so maybe that's a really good message to share today.
Oh, yeah, I think that's a good lead into that. So people don't really understand grams, and because we didn't learn that. We didn't even learn this in school. But on the back of labels, everything is listed in grams, essentially. So the understanding that 4 grams of sugar is 1 teaspoon is 1 sugar cube. So understanding that basic math is what really can help the viewers have their shopping power. And understanding also that the World Health Organization actually made recommendations back in 2015. Before that, we really didn't have a sense of what's too much sugar. But what they've stated makes sense. So children should not have more than 3 teaspoons of sugar a day. But as you just heard in Raisin Bran, they're blowing that budget and just by breakfast. Most children are blowing their budget. An apple juice, a little juice box has 6 teaspoons of sugar. It usually has 24 grams of sugar. So that's a lot. Women should not be having more than 6 teaspoons of sugar, and men 9 teaspoons a day. So, but we also know the average North American is exceeding 30 teaspoons of sugar a day. So there's a huge gap from what people should be getting and what they are getting. So it's really no wonder we're having this, escalation and rise of cardiometabolic disease with poor end organ function, meaning heart disease, dementia, liver disease, cirrhosis, and obesity-related issues. So they're very much connected. So that basic understanding and education, I think, can be hugely impactful for people. For example, like a fruit yogurt, like an Activia yogurt, has almost 4 to 5 teaspoons of sugar in it. That's almost a woman's budget for the day.
Wow. My
It's
goodness,
just
I had
making
no
better
idea.
choices, just making better choices, right?
And they're cumulative.
Yeah. And don't believe the marketing on the labels, right?
No,
There's no
exactly.
label on an apple. So there you go.
I think there's
I like
and
that. There's no label on an apple. That's perfect.
a heart does not mean that it's healthy on the
Yeah.
box, by the way.
Well, the American Heart Association used to endorse orange juice, right? Their label was on that. Like now it's no longer, but it was.
Yeah. It's really interesting how interconnected insulin resistance and metabolic health is to our entire bodies. Like we, I was listening to a podcast recently that was talking about dementia and Alzheimer's being type 3 diabetes and the research that they're doing about that lately. So this is very, very interesting. So for the millions of people who have established obesity or who are living with overweight and maybe they don't have any liver issues yet, or but they want to protect their liver and they want to prevent liver disease, what are maybe your top 3 or 4 tips that you want to give those individuals, that you want to leave them with today? Maybe I'll start with you, Dr. Joshi, and then we'll go over to you, Michael.
Oh, I love this question. So I think when it could like identify nutritional needs would be the first category. So avoid refined carbohydrates and added sugars. Number 2, prioritize protein intake. At least 30 grams a meal would be the recommendation, and 30 grams of fiber a day. Because protein and fiber will allow satiety and fullness and stable blood sugars. Because it's those spikes in blood sugar that make people more hungry, and that can lead to overeating and seeking out comfort foods. So by prioritizing protein and fiber, those behaviors might be minimized. And then number 3, doing something, as Mike already said, walk a little bit, walk for 20 minutes, a day if possible, and start with that. And then just keep on building more and more. When you start with a little bit, you realize, oh, I can do this. And then do a little bit more each day and taking measurement. Because I think when people measure, they know what they've improved upon and what they can change and improve upon next time.
Mm-hmm. Absolutely. Awesome. Thank you. Michael, if you could give, a few
Well, I'm going to go with the sugar is poison to start with. I really believe that. I think the other thing is we didn't talk about this today too, but there's a lot of guilt, and I'm talking about myself. We were brought up not to leave food on our plate, and the last year or so, I've worked really hard to actually leave food on my plate. So when I go to a restaurant, and it doesn't matter if I love it, like if it's really really good or dessert or something, I'll always leave something on the plate just to say it's okay to leave it, because it's the guilt that was making me eat when I shouldn't have eaten stuff. And I think the third is and this is the goal of not eating more and not storing more fat, is that you need to know when you feel full. That's a really tough signal to listen to in your brain. But I think if we listen carefully, our bodies probably tell us very often, you don't have to keep eating, you ate enough. But we push it. And even people who have had bariatric surgery can learn and relearn how to eat a lot again. And that's why diets yo-yo and everything else. So I would just say, just do the best you can to listen to your body.
Mm-hmm. Yeah,
These
we've
are
all been
to
finish with you can't have dessert until you finish your dinner. That was a strong message in my youth. And I also think it's interesting. Yeah. It's also interesting, the thought of knowing when you're full. I mean, for some individuals, that's easier said than done. So we do have, the GLP-1s and different interventions, which can then help someone with that as well. So very interesting. Is there one thing that you each wish everyone knew about liver health? Michael, I'll start with you. What's one thing you wish everyone knew?
that no matter how great you feel, you should get your liver health checked at least once.
Yeah, and I would say that it's reversible, because that always seems to be the shock for people. They think, oh my gosh, I have liver disease. I must have cirrhosis. I'm going to lose my liver. And the relief when I tell them, first of all, it's not that bad, but it's also reversible. And the connection to insulin resistance. So if you have liver fat, but you don't have liver damage, the message is still important that if there is liver fat, you have insulin resistance. So make a change.
So interesting that it's reversible. The liver is a fascinating organ. How long how long does it take to reverse something like this?
Well, liver fat can resolve quite quickly if people optimize multiple facets of improving their metabolic health. It can improve within a few months. And fibrosis, though, we're learning from data, it is correlated with weight loss, but liver fibrosis can improve, at least from the data we're seeing, 72 weeks, and people achieving some degree, at least 10% weight loss is the goal, to have reversal of fibrosis.
Oh, wow. Fascinating. Human body is fascinating, isn't it?
Which can be done, with lifestyle or with the help of a GLP-1.
Yeah. Or combination. Yeah, absolutely. That's so interesting. So, okay, well, thank you so much to both of you for joining us today and to take the time to have this conversation. Really wanted to also shout out to the Fatty Liver Alliance, and thank you so much for partnering with us on this session. A few key takeaways for me are, fatty liver disease is reversible. Love that one. It is a metabolic condition that watching our sugar, watching our blood sugar, taking care of our health, moving our bodies, all of that can really help to prevent this disease. Thinking about focusing on whole foods, our gut microbiome, a diverse diet, all of that is going to help the whole body, but also the liver to help us live, healthy and joyful lives. And those are really the big things that came out for me. Thank you so much for sharing all the different resources, tips for GPs on how to partner better with specialists and practitioners like yourself, Dr. Joshi. And Michael, thank you so much for the work you do to make all of this make sense to people like me who don't work in healthcare. So really appreciate you bridging that gap.
Thank you for having us.
Thank you for having us.
Okay, again, thank you to our experts today. This was fantastic. How to keep this conversation going? Please join us on our OC Connect platform. Make sure to join us on Friday for the live roundtable. And please check out our website at obesitycanada.ca.